me tell you something about the type of implants. There are two types of implants. One is the teardrop, the other one is the round implants. Vast majority of the surgeons use round implants. It is very rarely that we use the teardrop implants, because if you look at your torso, it is short and you got more of legs. That's the standard in everybody, whether you are short or tall. If your torso is long, so is your chest. Because your chest is long, you'll need a teardrop one. And that is where the problem lies. Very few people have got a long torso. Whereas round implants, on the other hand, can be used in everybody. And they give you the shape that you desire. They don't make your breast look round. They make them look perfectly natural and normal. Where do you place these implants? Either you can place them on top of the muscle or under the muscle. What makes people decide that? It's the amount of tissue that you carry on your chest. If you have very little tissue, there is no other way but to put them under the muscle, because that gives them extra cushioning and the cover. Whereas if you've got enough tissue, this easy thing to do is to pinch your own chest and see if you've got at least 2 centimeters of tissue there. That's good enough for it to be covered up by your own breast tissue, so you don't need to have it under the muscle. What are the big advantages of having under the muscle or over the muscle? Under the muscle, if you're a flat-chested lady, obviously you have to have it under the muscle, but there are problems because you have to lift the muscle, you have to cut part of the muscle up, and it stays under the muscle. Having done so, it tends to give you a very high profile look, which you may not want. Hence, your body habitus decides where the implant goes. Say for example, you've lost weight, or you may have had childbirth and you've lost volume there. Again, when you examine yourself, you can get a fair idea before even you see the surgeon as to say, where am I going to have these implants? What is going to be more useful? Going under the muscle has its own problems. It's pain, discomfort, more chances of having scar tissue, in other words, capsular formation. Whereas going on top of the muscle, it's easier, it's quicker, it's much pain-free or painless as compared to under the muscle. A lot of us are influenced by our friends. You may, as a patient, would have seen your friends have their breast augmentations done, and then you go ahead and have another consultation with a surgeon, and you desire exactly the same results. But you got to bear in mind that your body frame may look similar to your friend. You may be a slim person or otherwise, but your body shape is very different to that person. So you will not get the same results as you're expecting as your friend does. So she may have a certain cup size, she may look different to what your expectations, and if you ask the same result, it is nearly impossible to do so. Just bear in mind, there is no one like you on this earth, never has been, never will be. So maintain that uniqueness. So bear that in mind. Don't expect that same results as your friend or your colleague or your sisters had, because your body is different. Moreover, your breasts are under the influence of hormones. And as you know very well, every month, whether you are on the pill or on the depot injection, it makes very little difference. Your hormones cause a lot of upheaval. So the breasts do swell up, as you know, and then after the periods, they go down. So that changes the breast as well. Secondly, no body is symmetrical. I mean, absolutely nobody is symmetrical. In other words, half your body is asymmetrical to the other half. What I'm trying to say here is, one breast is slightly different to the other in shape, in size, in proportionality. So when you have the consultation, if you have one breast smaller than the other, the consultant surgeon might inform you that he might use different size implants. So that's to try and bring them to more sort of equal proportions. But you got to bear in mind, they will never be exactly the same.